I'm Dr. Richard Nadler, and today's question is, what is sleep apnea and why would I see a dentist about it? That's a great question, and one which we have been hearing more and more in the past several years. Obstructive sleep apnea, or OSA, is a condition which affects a significant and growing number of patients. Those who have this problem stop breathing during sleep as many as 20, 30, or even more times every hour. Each time breathing stops, the patient must wake up and begin breathing again. As you can imagine, people with this condition do not get enough sleep. When they get up in the morning, they don't feel fully rested, and they become sleepy at various times during the day. Nodding off while driving is a most severe consequence, and one which has become more prevalent in the past several years. In addition, the chronic nighttime lack of oxygen has many dire effects on the bodies of people who suffer with this problem. A medical history of adult onset diabetes, high blood pressure, stroke, GERD or gastroesophageal reflux disease, as well as anxiety and depression may all indicate an underlying obstructive sleep apnea problem. What's important to know is that this condition is life-threatening, but it can be treated. If you snore, have ever been told that you stop breathing at night, or often wake up choking or gasping, you may benefit by being screened for obstructive sleep apnea. Why would you see a dentist about this condition? Your dentist examines your mouth usually twice every year, and he or she is in a perfect position to evaluate your airway as well as your medical history to screen you for this condition. In our office, all patients are provided an obstructive sleep apnea questionnaire which identifies potential sufferers. In addition, we examine your airway to see if you may be a potential sleep apnea patient. Any patient suspected of having obstructive sleep apnea is directed to have a sleep study to confirm the diagnosis. We work with several sleep centers in our area and can help you arrange these studies to find out whether or not you have the condition. Depending on the severity of sleep apnea and your anatomy, there are three basic ways to address this problem. The primary way that obstructive sleep apnea is treated is by the use of CPAP, or continuous positive air pressure machines, which are worn during sleep to keep the airway open. Sometimes surgery is an option to help increase the airway size, and for those with milder sleep apnea and those who cannot wear a CPAP for one reason or another, there is a dental appliance which is worn to assist in keeping the airway open. If you suspect that you may have sleep apnea or have questions about it, please feel free to contact our office for help. It will be our pleasure to provide information about this most serious condition to you. I am Dr. Richard Nadler, and it's been a pleasure sharing this information with you.